By the time you're considering treatment options for a suspected torn anterior cruciate ligament, or ACL for short, you may be considering a surgical reconstruction. You're likely to have already spoken with a doctor or seen a physiotherapist who has advised you to speak to a knee specialist regarding your injury to further discuss treatment options available. In this video, I'm going to do a quick run through of what an ACL reconstruction is using a keyhole technique known as a knee arthroscopy, and also what to expect during and after the procedure. My name is Nev Davies, a specialist knee consultant surgeon here at Circle Reading, and affectionately known as Nev the Knee. It's worth mentioning that you don't always need surgery to reconstruct a damaged ACL. Alternative ways of supporting your knee through physiotherapy and bracing may stabilise your knee so you can manage your daily activities. Most people, however, who are active in sports, particularly those pivoting sports such as football, rugby or netball, as well as your keen skiers, will opt for a reconstruction. Physio before the operation, what we call Prehabilitation, for a good few weeks with a specialist knee sports physio, is imperative to get over the acute injury phase and prepare your knee for surgery by getting the swelling down and getting a good range of motion back. A knee arthroscopy is a common and useful operation using a keyhole technique to look inside the knee joint with a special fibre optic camera. We use small scars on either side of the kneecap. The device looks like this. By doing this, we were able to get a clear view of the inside of your knee and can assess the ACL to confirm that it's been damaged, but also assess the other structures that sometimes are injured during the twisting injury, known as the pivot shift. These are importantly the shock absorber meniscal cartilages, as well as the joint surface cartilage on either side of the knee. If we can see that there's obvious damage, then these can be repaired, and we will do it there and then. The reconstruction then involves borrowing two of your hamstring tendons and threading them across the knee to make a new ligament. It's all done keyhole inside and fixed at the top with a button and on the bottom with a special screw. We then examine your knee to check that it's rock solid stable. You will meet the anaesthetic doctor on the morning of the operation, as the whole procedure will be done under a general anaesthetic. So being asleep for this whole process means you won't feel any pain. Before the anaesthetist wakes you up at the end, the surgery usually takes an hour or so. We fill the knee and all around with long-acting local anaesthetic. This will make everything numb for several hours. As it gradually wears off, simple regular painkillers are then needed, such as paracetamol and ibuprofen, and you take these for the first few days. The early recovery phase usually takes a few weeks, and keeping your leg elevated with regular ice packs is really important, particularly in those first few days. Most people would go home later that day of surgery and will be on crutches for support for about a week to 10 days. We allow driving from about 6 weeks. You'll meet up with the physios regularly to start with, and then those visits generally spread out over time. You'll get homework exercises to do. I also see my patients back at 6 weeks, 3 months and 9 months in clinic to check progress. In most people, if rehab progresses well, then we would look to return them to sports at 10 to 12 months post-surgery. So it is a really big commitment to physio and rehab, and I often tell my patients they can have the best surgeon in the world performing the operation, but if they don't put the effort in with the physios, it's not worth going through with it. Success rates for this surgery are generally very good, with 80 to 90% of patients returning to their previous pivoting sports. The risks are generally low, as surgery is keyhole, done as day case, and the patients are generally very healthy having this sort of surgery. So that was a brief run through of the surgical options for ACL reconstruction using the knee arthroscopy keyhole technique. If you'd like to come and see me for a consultation to talk through your options for ACL injury or any knee problem, you can book online via the link in the description below. Alternatively, search for your nearest Circle Health Group hospital and the next available consultant in your area on circlehealthgroup.co.uk. If you have any questions on anything that I've covered in this video, please do comment below. We'd love to hear from you. Otherwise, thanks for watching.